Okay, I'm going to demonstrate how I would use a gua sha tool for what would be carpal tunnel, which is the median nerve. So quick anatomy. Here, right in here would be your carpal tunnel. So this area right here, that is where the nerve itself gets pinched. The median nerve basically comes right about in through here from the elbow, trickles on down, comes down through the carpal tunnel, and then goes to your thumb and then these two fingers. So what I'm going to do is take some of my cream here, and I'm going to work the whole thing. The main areas that I'm going to work are right here in the carpal tunnel, starting off lightly with the tool, finding areas that are a little bit sensitive, and then working those areas over. And how long I go varies, but in general, I'll go lightly until some of that discomfort has kind of dissipated. And so right in there, some of that discomfort has gotten significantly less. So then I could begin to use a little bit more pressure and working my way up. So again, that median nerve comes right through here and goes on down. So I want to work that whole thing, because even though the pinch point for carpal tunnel is right in here, that whole nerve and all those muscles can be inflamed. So when I'm on the muscle, I can use a bit more force down in through there, trying to increase blood flow. And even as I do this, I do feel a tingle down in my hands. Not the end of the world. It's not that bad. It's just common. You're putting pressure on a nerve and muscles, so you will feel a lot of times a little bit of tingle. So I work this area for a few minutes. Again, I'm kind of waiting for spots that are a little bit tender for that tenderness to dissipate. So right in there, I can feel some stuff. So I'm going to work that. I would work that till it dissipates. And then again, I'd kind of explore other places as well. Kind of work in that area. Direction does not matter. Sometimes you'll find like going this way, proximal to distal, feels different than going distal to proximal. So like on me, when I go distal to proximal, it's not as uncomfortable as going proximal to distal. So I'll work that area, do the carpal tunnel, and then I'm going to go into the palm of the hand. So right through there, I'm going to work that thumb, the muscles of the thumb. Got a little tender spot right in there, so I'm going to work that for a couple minutes. Till that dissipates. And then I'm also going to check right here, kind of the base of the palm, where that carpal tunnel, the carpals join together. That's a common spot as well. So I'm going to work that whole area. And even though the nerve goes to these fingers, I'll check the whole palm, because sometimes it just feels good. And again, if I find an area, on me, I'm not finding anything, but I'll find an area that's tender, common spots right there, and then again, I will work it lightly until a lot of that tenderness is dissipated. Then I can add pressure to it, increase my pressure. Okay, now I'm feeling that a bit more now. And then I'll work that area until that tenderness again dissipates. But that's the basics of what I would do. And again, time varies. If my hand gets tired, my treatment hand gets tired, then I may take a break sooner and then get back at it. But how many times I might do this throughout the week, on me, when I use this, I'm going for about hopefully I only have to do it like once, and then it kind of keeps it at bay. But if it was really flared up, I may do it twice a week with a few days in between, because you want to let it heal. Let the blood flow, the body do its thing, and let it heal before you do it again. If you do it too close together, it's not the end of the world. It's just uncomfortable. So that is the demonstration that I have for doing carpal tunnel. So median nerve through here, down through the palm. The biggie points of emphasis are going to be that median nerve that goes down, carpal tunnel, flexor retinaculum, all the fancy anatomy terms, and then working the palm area itself. Sometimes if you need to, you can ice it afterwards. You don't have to, but sometimes it'll feel warm. So icing it afterwards can be helpful as well. So there you go.